Welcome back. We are here with a dear friend of ours from Harvard Eye Associates. We have Dr. Diana Kersten today. How are you?
I'm good. Thank you for having me on the show.
I'm glad to see you today because you have a very exciting new development to tell us about.
Yes, about a year ago there was a new lens FDA approved for cataract surgery called the Technos Symphony lens, and it's really taken cataract surgery by storm. It's a multifocal lens, and we've had multifocal lenses for about 20 years, but this is such a leap in improvement from the old multifocals that already this lens has 80% of the market share in the US of all patients having multifocal lenses. And this shows a patient with a cataract. People are often confused about cataract surgery versus LASIK. Cataract surgery is when the lens in the eye gets cloudy. And the next slide shows what the eye looks like. So when you see that cloudiness behind the pupil, it's actually the lens that's gotten cloudy. And
oh, and I see in this illustration, the lens is this, it looks like a bubble.
Right, it's a disc right behind the pupil. Most of the time people have it done before it gets white, but an end-stage cataract, the pupil will look white. And the next slide also shows how an implant goes in the eye. So when we do cataract surgery, we're vacuuming out your old lens that's gotten cloudy. It's called a cataractus lens. And then we're putting an implant to maintain the focusing of your eye, and we put it right into the capsule of the old lens. So it's sitting right behind your pupil. And in the past, people just had cataract surgery for distance, and then they wore reading glasses predominantly.
Yes, reading glasses. I'd love to get rid of those.
And more cataract patients would love to get rid of their glasses. So many people do one eye distance, one eye near, especially if they've done that with contacts or they've done that with LASIK, so they know that they adjust and that they like it. A lot of people don't adjust, so you have to make sure the patients like that. And then 20 years ago, the multifocal lenses started, and as I said, they've gotten better and better and better, and then a year ago, there's this big leap in technology.
1 year ago.
Well, so FDA approval 1 year ago.
Oh, well, FDA approval in the United States. So we've had 20 years of multifocal lenses, but a year ago, this new lens has been able to be used in the United States, and it has more capacity for different areas of vision.
Right, and I think the next slide shows this also.
Let's see. Oh, there's the lens right there.
This is an old-fashioned implant, actually. This is a regular implant or a standard one. So the whole center part of that, or the optic, is one power, and usually we do it for distance, and the little loops on it are called haptics, and that keeps it centered. And then the next slide shows the new implant. And so the Symphony not only is out for patients that have regular eyes, but it's out in an astigmatism version also.
Oh, you can see the rings.
On the side with the little lines is the astigmatism version. So the little rings you know, are distance, near, distance, near. So it's not like a bifocal in glasses up to down. It's in a ring shape. And multifocal lenses have always been like that, in a ring shape. But the problems in the past have been that with the older ones, you could see near and you could see distance, but not in between.
Right.
And the halos from the rings would be sometimes an issue, and also contrast sensitivity would sometimes be an issue. But this new lens has worked out so many of those issues, and the patient satisfaction is amazing. We're really not seeing halos, we're not seeing reduced contrast sensitivity. It's been a very, very popular lens with our patients, and so I'm excited to talk about it.
Well, and it's 80% of this multifocal market
business
now
in the U.S., and that's after just 1 year of FDA approval. So that shows how much ophthalmologists are realizing that it is so much better.
It's valuable. And so, of course, everybody knows the bifocal is kind of a linear way of experiencing vision. You have the far vision, and then as you look down, you're able to get that close-up vision. And these lenses have, for 20 years, made that a more concentric pattern. But this new lens gives you so much more capacity to see because you have the middle range.
It does. It really does. And the next slide shows a bit about how it works. In the past, I think of it like a segment bifocal. Remember the bifocals where there's a little segment? So that's our, first bifocals are like that. And then progressive bifocals started in glasses. And at first they were a little clunky, and they didn't always work. Well, this technology and how it's improving is kind of like the bifocal business, and this shows how this implant works. It literally, instead of having a focus at distance and a focus at near, it has kind of an elongated focus or a depth of focus that just works better. It's kind of like a progressive bifocal in an implant. And there's a lot of physics in it that I'm not even, there's an echelon pattern. I think the next slide shows that. It's just a new way of creating a gradient of refraction that works so much better and is a very, very different design from the previous multifocal lenses.
Well, you certainly can see from this illustration how slender the lens is.
Yes, these lenses are very thin. Yes. Your natural lens is often as much as 3 millimeters thick, and these lenses are much less than 1 millimeter thick. So they're, once an implant's in your eye, you and I were talking about this, the angle of that gets much deeper, and people with narrow angles and issues with glaucoma often also see their that issue getting better.
That's exciting news, to think that implants not only improve your vision, of course, but that they really can help with any issues that you may have with glaucoma or the onset of glaucoma.
Almost everyone that has cataract surgery that has glaucoma, their pressure is better after the cataract surgery.
That's good to hear. No more drops,
well,
no more worrying.
They stay on drops, but not as many drops. It's just often much easier to control.
Yes.
And there's little eye stents, little additive things we do with cataract surgery where we do the entire cataract surgery and at the very end place a little stent in the drainage meshwork of the eye, and that makes your pressure even lower. So cataract surgery's really evolved, and I've been doing it in Orange County for 29 years, and I love it, and I love figuring out the right way to do it for different patients and talking to patients about it and making sure that they have the best technology for their needs.
And the technology changes, and so in the past year, this new lens has been used in the United States, but it's wonderful for people to just know what's the newest thing on the market, because there's so many choices out there. It can be confusing.
Yes, there are a lot of choices, and patients often ask me what's the best lens, but the truth is it depends on the patient so much. There are a lot of patients I won't recommend this lens for example, because if you have macular degeneration or significant glaucoma where you've lost peripheral vision, any other serious problem with your eye where you're not seeing 20/20 or close to it, then you really probably won't do well with this implant. A lot of patients who come in and they've been wearing contacts and they do one eye distance, one eye near, they're usually very happy with that, and that's a less expensive option for that, so I do a lot of that as well. And we're very aware these lenses do cost more, and some people don't want to spend it, or they're on a fixed income where it's just not in their budget, and we're very aware of that, and I feel strongly that we should present the options but then let the patients decide.
And then they have their better vision.
Yes.
Their whole life can change.
Yes.
And I know with the kind of vision that you have, doctor, you do some very exciting things. Are you a rock climber?
I'm a skier. I'm a big reader. I'm in 2 book clubs. I love to run. I love to swim. I have a 16-year-old son, so I'm very busy with that. Life's very full. I think we have a couple more slides about the lens. This shows a little bit. This is this new proprietary design that makes it a progressive bifocal called an echelon design, and it's basically a series of little kind of grooves that create this better depth of focus, extended range of vision. It also really cuts down on the contrast sensitivity issues that we've had with some of the other multifocals. And I think the next lens also...
It's kind of interesting because those concentric rings, immediately they look like a recording disc. I mean, it looks like an LP.
They do, don't they? I didn't really think of that. They do. And this lens shows how there's also better chromatic vision, color vision with these implants. Yes, because of the design, there's less chromatic or color aberrations with this design.
Wow.
And I think there's one more slide. Yeah, and this shows... On the top is a single focus lens, and it shows the narrow range where you can see distance, and everything else is a blur. And the second is an old-fashioned or previous multifocal lens where there's two distinct foci, where distance is in focus and near. And then the bottom is the New Symphony, where there's this elongated focus, where literally you see distance close up and near.
And you know, in this graphic, it's a little faint. It's hard to see.
The Technos Symphony lens. It's made by AMO, and it's become very popular. I'm sure patients that are considering cataract surgery are going to be hearing about it because it's very popular right now.
And it was good to see in the graphic that had the foci, the single focus. You could see just there in the center. Really, it just had one point that you were able to see through. And the multifoci, that was the earlier model, had in the graphic. If you could show that one with the green stripes on it.
Yeah, the previous one.
Yeah, previous to this. There it is.
Yes.
And this middle graphic, it's faint, but you can see that there's a concentration of foci there and a foci right there.
Right.
So that's what the older lenses used to do, the near and far. But this graphic right here shows the elongated focus.
Exactly.
So what you see is that you don't have distinct small foci of being able to see. This elongated foci really...
It's extended, is what they call it, extended range of vision, extended focus. It works so much better. I think all of us ophthalmologists who do cataract surgery are really happy to have an implant that's so popular with the patients. It's, you know, the patient satisfaction is enormously high, and that's been a really wonderful thing to have so many happy cataract patients.
It's true. Well, it's a wonderful thing to come in and be able to speak with you, Doctor.
Thank you,
This is Dr. Diana Kersten, and come in and speak with you at Harvard Eye Associates or from one of the other wonderful doctors there, and just get an assessment, get an idea of what could be possible for you.
Absolutely, yeah. We see patients there 5 days a week, 6 days a week in our San Clemente office, and we have 8 cataract surgeons and a wonderful plastic surgeon for around your eyes. We've got a retina specialist, a glaucoma specialist, 2 corneal specialists, and 3 optometrists. And it's been a wonderful practice. We've gotten much bigger, and we're still really focused on keeping our warm, kind of nurturing environment.
Well, staying focused is certainly the best thing about Harvard Eye Associates.
Yes,
thank you for being here with us today, Doctor. And it's so nice to hear about this wonderful new product. And please come back and tell us some more about the next things that are coming out.
I'd love
we can learn about.
Thank you.
And thank you for being with us as well. Stay with us because right after this, we're going to welcome the Friends of the Village. We'll be right back.